Hey everyone, welcome back to the channel. Today we're talking about something that sounds scary, but is actually more common than most people realize: a dead or dying tooth. Many people walk around with one and don't even know it until serious problems start. In this video, I'll break down exactly what a dead tooth is, the 4 major signs to watch out for, what causes it, and what you should do if you think this might be happening to you. So first, what is a dead tooth? Inside every tooth is a soft area called the pulp. This pulp contains nerves and blood vessels that keep the tooth alive. When that blood supply is cut off, the pulp tissue dies, and the tooth becomes what dentists call a dead or non-vital tooth. This usually happens because of untreated cavities, trauma to the tooth, repeated dental procedures, or infection. What makes this dangerous is that the tooth can look fine on the outside, while serious damage is happening on the inside. The first sign you might have a dead or dying tooth is discoloration. A healthy tooth is usually white or slightly off-white. When the pulp starts to die, the tooth can slowly change color. It may turn yellow, gray, brown, or even black. This happens because the dead tissue inside the tooth breaks down and stains the inner structure. Toothpaste, whitening strips, or professional cleanings won't fix this type of discoloration. If one tooth looks noticeably darker than the others, especially if it wasn't always that way, it's a red flag that something is wrong beneath the surface. The second sign is a foul smell or bad taste that doesn't go away. If you have persistent bad breath or a strange, unpleasant taste in your mouth even after brushing, flossing, and rinsing, a dying tooth could be the cause. As the pulp tissue decays, bacteria grow inside the tooth and release gases and toxins. This can lead to a constant bad odor or taste that seems to come from one specific area of your mouth. Many people assume this is just a hygiene issue, but when it doesn't improve, it's often a sign of internal tooth infection. The third sign is pain or sensitivity, though this one can be confusing. In the early stages, you might feel sharp pain or sensitivity to hot or cold foods and drinks. Chewing may also feel uncomfortable or painful on that side. As the nerve continues to die, the pain may actually disappear, making you think the problem has resolved. But that doesn't mean the tooth is healthy. The surrounding tissues can still become inflamed or infected, leading to deep, throbbing pain later on. So pain that comes and goes or sensitivity that feels different from normal should never be ignored. The fourth and most serious sign is swelling, or the formation of an abscess. When a dead tooth becomes infected, your body tries to fight the bacteria. This can cause swelling in the gums, face, or jaw near the affected tooth. Sometimes a small bump filled with pus forms on the gum, known as a dental abscess. This is a serious condition. An untreated abscess can spread infection to the jawbone, nearby teeth, and in severe cases, other parts of the body. If you notice swelling, redness, tenderness, or a painful bump near a tooth, this is a dental emergency. Now let's talk about what causes a tooth to die in the first place. One of the most common causes is untreated tooth decay. When cavities aren't treated, bacteria can travel deep into the tooth and infect the pulp. Trauma is another major cause. A fall, accident, or sports injury can damage the blood supply to a tooth even if there's no visible crack. Repeated dental procedures on the same tooth can also weaken it over time, increasing the risk of pulp damage. In some cases, grinding or clenching your teeth can contribute as well. If you think you might have a dead or dying tooth, the most important thing to do is see a dentist as soon as possible. Waiting usually makes the problem worse and limits your treatment options. A dentist can confirm the diagnosis using X-rays, pulp testing, and a clinical exam. Treatment depends on how advanced the damage is. In many cases, a root canal can save the tooth. During a root canal, the dentist removes the dead or infected pulp, thoroughly cleans the inside of the tooth, and seals it to prevent further infection. A crown is often placed afterward to restore strength and function. Despite their reputation, modern root canals are routine and effective. If the tooth is too damaged to be saved, extraction may be necessary. While losing a tooth sounds scary, modern dentistry offers excellent replacement options, such as dental implants, that look and function like natural teeth. Prevention is always better than treatment. Brushing twice a day, flossing daily, and visiting your dentist regularly can dramatically reduce your risk. Treating cavities early, wearing a mouthguard during sports, and avoiding excessive sugar also help protect your teeth from long-term damage. To sum it up, the 4 major signs of a dead or dying tooth are discoloration, persistent bad taste or odor, pain or sensitivity, and swelling or abscess formation. Catching the problem early can save you from serious pain, infection, and costly procedures later. If you notice any of these signs, don't ignore them. Your teeth are meant to last a lifetime, and taking action early can make all the difference. Thanks for watching, and I'll see you in the next video.